Welcome back to Sonora Living Live, and we are back with Dr. John Kressel from Phoenix CyberKnife Center. And we told you earlier he was going to answer some of your questions because we know this is a very scary time for a lot of you, and you're wondering about your approach to cancer treatment. So we had folks solicit questions, and this is what one viewer wants to know. I have been told that I have no options and my tumor is inoperable. Is CyberKnife an option for me?
Well, every case is individual, so I'd encourage people to talk to their physician or contact our offices so we can kind of individualize that treatment or response. But two things I'd mention is that CyberKnife does offer radiosurgery for medically inoperable lung cancer, which is now the preferred treatment, and it's NCI guidelines, and that was made 2 years ago. So that's something for a medically inoperable person. And also for retreatments. CyberKnife can retreat patients who may not have any other treatment options because of prior therapies that they've had. Again, a very powerful part of CyberKnife and radiosurgery is being able to retreat people.
Alrighty, let's get to our next question. This viewer writes, my son is 26 and had a brain tumor the size of an orange removed 2 weeks ago, but 10% remains, and now the reports say it is a level 4 cancer. Is he a candidate for CyberKnife? If not, can you treat him with other technologies there?
Good question. Again, radiation therapy in general is a main treatment discipline for CNS tumors or brain tumors. Radiosurgery and CyberKnife has been proven to be effective in many instances. So in this case, again, I'd want to have more information for the best response possible for that patient. But in general, I would say that it's very likely that CyberKnife and radiosurgery could be of benefit to this type of individual. Alrighty,
let's get to our last viewer. They ask, is there any kind of cancer you cannot treat? Why aren't other facilities offering these types of treatments?
Well, there's not really a type of cancer that might not at some point be appropriate for CyberKnife or radiosurgery. So again, it's more important to kind of keep that in the discussion for individuals and consider it. So physicians may not even be aware of the benefits of CyberKnife and radiosurgery in many instances. With regards to if it's something that they should consider themselves, again, we need to individualize it because there isn't just one type of cancer that we don't treat.
But I think the important thing, and this is what you and I were talking about earlier, talk about it. Have dialogue. Get the conversation going about treatment.
Yeah, unfortunately, we do see too many patients where CyberKnife or radiosurgery could have been a treatment option for them sooner. And the point in time that we actually see them, it's kind of a little too late sometimes, and that's always what the big scare is. So
absolutely.
Again, we try to make ourselves available and a resource to everybody in the community.
And even if it's just a phone call, right? Even if it's just to kind of put your mind at ease.
One of the things we commonly do is we review medical records and films and provide some input to the physicians or patients without actually formally having them come in, just to help them get started on that.
Alrighty, well, like Dr. Kressel said, get the conversation going, get it started. If you have questions for Phoenix CyberKnife, you can email them at info@pcroc.com. Give them a call as well, 602-441-3845, and you can find so much more information on their website at phoenixcyberknifecenter.com. And Terry, my jaw dropped earlier hearing how much that Hermes bag was worth. My goodness, now you have an entire set of Louis Vuitton luggage.
Yeah.